Hello, I'm Dr. Donald John Babu, surgical oncologist and robotic surgeon, Fortis, Hirananda Nivashi, New Bombay. I'm primarily trained for surgical oncology at Tata Memorial Cancer Center, Bombay. I've also been trained for robotic surgery from the same institute and was at Tata Cancer Hospital for the last 5 years. Today we'll be discussing thyroid cancer. Thyroid cancer can be divided mainly into 4 parts. The first part will be the causes and the etiology of thyroid cancer. The second will be the screening and the diagnosis of thyroid cancer. The third will be the staging of thyroid cancer, and finally the treatment modalities of thyroid cancer. The etiology and causes of thyroid cancer are not well defined. Most of them arise from long-standing hypothyroid patients. Some few causes of thyroid cancer that have a direct causation are radioactivity. A lot of cancer patients living in parts of Russia and Japan where radioactive material have been exposed have come back with thyroid cancers. Long-standing intake of high iodine content also are causes of thyroid cancer. A few cases of thyroid cancer have also been related to genetic causes, but a direct causative factor has not been found as yet. The screening and diagnosis are very simple. Any patient coming with a swelling in the neck has to undergo a USG of the neck. The USG of the neck has a lot of advantages. It can differentiate between a benign thyroid lesion and a malignant or a cancerous thyroid lesion. It can also tell us regarding whether the lymph nodes in the neck are positive for metastasis for thyroid cancer. This is also followed by a few blood tests which include your thyroxine levels, which is your thyroid hormone levels, the T3, T4 and TSH. Sometimes we also do serum calcitonin, serum CEA, depending upon what type of cancer it is. The USG also helps us to get an FNSE or a biopsy from the thyroid lesion. The thyroid FNSE or the biopsy gives us a direction as to what kind of thyroid it is, what kind of cancer it is, and what kind of treatment will the patient undergo. Once thyroid cancer has been diagnosed, the biology of the thyroid cancer is generally divided into 3 parts or 4 parts again. One, and the most common, being the papillary thyroid cancer. Second being the follicular type of thyroid cancer. Third being the medullary thyroid cancer. And fourth, which is one of the most rarest but the most dangerous, is the anaplastic thyroid cancer. The treatment for thyroid cancer generally is total thyroidectomy with neck dissection. The papillary thyroid cancer the treatment finishes off with a simple surgery, which is thyroidectomy and the neck dissection. Once the reports are available, patient generally undergoes the radioiodine treatment, which is a simple injection of radioactive iodine into the blood. It's a single shot treatment. The next treatment schedule is only after 6 months, and that too if the radio scan is positive for any kind of metastasis. There is no role of chemotherapy or radiotherapy in thyroid cancer. Follicular thyroid cancer is treated in a similar manner. Medullary thyroid cancer has a different biology. A localized medullary thyroid cancer is treated with surgery, but a metastatic one requires chemotherapy as well. Anaplastic thyroid cancer generally begins in stage 4, very difficult to treat, chemotherapy and sometimes surgery being the only option. Thank you.